Welcome back. In this video, we'll talk about the most common presentation for autism. The first part relating to social engagement and communication. We see this mainly in young children. They wouldn't respond to calling their name, and parents often confuse this with hearing impairment. They also resist cuddling and holding and prefer to be alone and playing alone. They have poor eye contact and lack the facial expressions, so they wouldn't express anger, happiness, or sadness. They don't speak to start a conversation or keep one going, so if you speak with them, they will speak back, but just in short sentences and short words to end the conversation and not continue it. If they do start a conversation, however, it would mostly be to label things or to request something. The tone of voice would be very abnormal and seem robotic-like. They don't express emotions or feelings and seem to be unaware of the emotions or feelings of others. They don't show interest by pointing at things and don't show interest by sharing things with others. And they have very high difficulty in recognizing nonverbal cues, which are signs that we give off when we talk to other people, such as the tone of voice or the body posture. The second part is common presentation relating to behavior. And these include performing repetitive movements such as rocking a chair or spinning or hands clapping, performing repetitive activities that result in self-harm such as banging their heads or biting their lips. They have odd or stiff or exaggerated body language. They're often fascinated by small details without a specific reason, like having a fascination with windmills, for example. They rarely engage in role-playing or imitative games, and they often have very specific food preferences. We screen for autism at 1.5 years old and then again at 2 years old. A psychiatrist can easily spot the signs and symptoms, even the subtle ones, at this age. You should consult your physician, preferably a psychiatrist, if you notice any of the following behaviors. If the child does not respond with happy expressions or smiles at around 6 months old, if they don't mimic sounds or facial expressions by 9 months old, if they don't babble or coo by 12 months old, if they don't use hand gestures like pointing at objects or waving by 14 months old, if they don't say any words by 16 months old, if they don't play pretend games by 18 months old, and if they don't say 2-word phrases by 24 months old, which is around 2 years. Alright guys, that's all I have. Thank you so much for watching and hopefully this helped.